Hello, welcome to my channel, the PBM and Tinnitus Lab. I'm Dr. Katoyun, and in this video, I'm going to talk about the triggers and improvers of tinnitus. This is the sixth session of the tinnitus series. If you are a tinnitus sufferer, you may may have experienced the periods of flaring up your tinnitus, the times that your tinnitus became louder or more annoying. This is because of the triggers, and if you know more about the triggers, you can avoid them, and so you can better manage your tinnitus and cope with it. In fact, the triggers don't cause tinnitus, but they amplify neural activity or perception of an existing tinnitus signal. These are the main tinnitus triggers. The most important triggers are noise exposure and emotional stress. There's also triggers related to sleep disturbances and related to diet, to medications, and there are some physical and postural triggers and medical and physiological triggers, and some sensory and environmental and also psychological and perceptual triggers. But in this video, because I don't want it to be very lengthy, I just talk about the noise exposure and emotional stress as the triggers of tinnitus. And I will talk about the others in the next videos. Nose and sound exposure can trigger tinnitus. There is, for example, chronic noise exposure in industrial noise and loud music and headphones, and also sudden acoustic trauma, which is seen in explosions and gunshots, and occupational exposure, which is seen in factory workers, musicians, and military personnel. But why noise exposure makes tinnitus worse? Because it damages to cochlear hair cells. Hair cells in the inner ear convert vibration of sound to electrical signal, and they are very important in hearing, and also it damages to synapses between hair cells and auditory nerve fibers, which causes hidden hearing loss. You see that your hearing tests are normal, but you have a kind of hearing loss. So this is because of the damage to synapses between hair cells and auditory nerve fibers. Okay. And it can activate a stress pathway that links tinnitus to anxiety and emotional distress. This is related to limbic system. But the consequences of noise exposure are ear fatigue. It means that the noise stressed the hair cells in the inner ear and causes hearing sensitivity to drop slightly for hours or days. So it may cause a loss of input, because the hearing sensitivity is dropped. And loud noise can activate the stress pathway in limbic system, and tinnitus sound emotionally tagged as important. So the brain focus on it. and there is a synapse dysfunction. It means that the synapses between hair cells and auditory nerve fibers damaged and leads to disruption in signal timing and clarity, and also the brain in this condition the brain tried to fill the gap by increasing internal sound, which finally perceived as a phantom sound or tinnitus. So the internal sound is increased because the brain wants to keep its balance. But the tinnitus spikes can be happened immediately after hours and even the next day, because the inflammation and damage take time to develop, and also the brain gain adjustment is not instant. The brain's hypersensitivity and the brain's compensatory changes take time to be happened. But why repeated exposure, noise exposure is especially harmful? Because each noise exposure adds cumulative damage, and the damage will be, oh, I'm sorry. The damage will be increased after each sound exposure, and a temporary and repetitive sound exposure can convert temporary tinnitus to permanent tinnitus. And the brain, in repetitive exposure, the brain learns the tinnitus signal over time. So it's very harmful. In summary, noise exposure damages inner ear structures, and it leads to reduces normal sound input, and this reduce of input forces the brain to compensate, and finally creates persistent abnormal neural activity, which perceived as a phantom sound and as the tinnitus. So it's very critical to protect your ear from noise exposure. If you can, you should avoid being in a noisy environment when possible. And if it isn't possible, you should use hearing protection, including ear plugs or ear muffs, and you should keep headphones at safe volumes. The second trigger that I want to explain in this video is stress and emotional factors, including acute stress, anxiety or panic attacks, emotional trauma, and also mental fatigue. Mental fatigue is happened due to sustained concentration or stress or multitasking or emotional strain, or when there is a lack of rest. So it can be a potent trigger of tinnitus. But how stress triggers tinnitus? It can lead to hyper awareness. Cortisol and adrenaline are the stress hormones, and they can increase the excitability of auditory neurons, and brain becomes hypersensitive, and a feedback loop creates due to stress in limbic system, because limbic system has a gatekeeper filtering. It means that it has the ability to ignore the repetitive and non-informative sounds. But in the stressful situations, this gatekeeper failed, and the noise, the tinnitus sound causes stress, and the stress signals the brain to pay more attention to the tinnitus noise. It means that there will be a kind of a vicious circle or cycle. And there are some physiological changes in stress. The stress hormone cortisol constricts the blood vessels and reducing oxygen delivery to the hair cells, which leads to a loss of input, and increase the loss of input. And stress causes clenching the jaw and or TM joint, and tensing the neck and shoulder muscle. All of them can be the trigger of tinnitus. Since stress and tinnitus feed each other or make a vicious cycle, management often focuses on breaking the cycle. Cognitive behavior therapy is a very good treatment for this condition. It helps in mindfulness and retrains the brain to stop viewing the tinnitus sound as a threat. And physical relaxation is very useful. For example, meditation, yoga, and some other kind of relaxing activities, which reduces jaw and neck tension and lower the physical triggers of tinnitus. And also photobiomodulation or PBM therapy. Anxiety and depression are the consequences and side effects of stress. And as I told you, as a result of my systematic reviews and also the other studies, PBM is strongly recommended for treating depression, and is recommended for treating anxiety. As I told you, there are some home care devices for treatment of depression and anxiety, and you can use them under the prescription of your doctor. But as I told you, there are some factors that may help relieve tinnitus, the helpers or improvers. Tinnitus patients always ask about the role of vitamins. Vitamins are useful when tinnitus is associated with documented vitamin deficiency, anemia, or neuropathy, poor diet or malabsorption, and chronic illnesses like diabetes and thyroid disease, and also in older age. And the most commonly used vitamins are vitamin B12 helps nerve function and repair. B complex supports auditory nerve metabolism, and vitamin D3 helps calcium metabolism and inner ear function, and vitamin C, which may protect against noise-induced cochlear damage. You should notice that there are limited evidence about effectiveness of vitamins in tinnitus. They are just helpers in some people, and they aren't cure. Uh, and about minerals, there are some evidence that in some conditions they can be useful. Magnesium, which magnesium supplements, which can helps in protect against noise-induced tinnitus. This effect was confirmed in a study, and they can calms neural these supplements can calm neural excitability. Zinc products, their deficiency can be linked to tinnitus in some patients, and they helps immune system and neural function. And iron, which helps when there is tinnitus is related to anemia. Um, the most common used herb in tinnitus is ginkgo biloba, and there is a systematic review that partially confirmed its effectiveness as a helper in some kinds of tinnitus. Ginkgo biloba improves microcirculation in the inner ear and has antioxidant and neuroprotective effects. And it may reduce tinnitus related to vascular insufficiency, aging, or cognitive stress. You should notice that ginkgo biloba may offer modest benefit for selected patients with tinnitus, but it isn't a cure. Thanks for your attention. I will talk about the other triggers and improvers of tinnitus in the next session. If this video was useful for you, please suggest the channel to your friends and to the other people, and subscribe the channel. Have a nice time and stay tuned.